Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Strengths and Difficulties Questionnaire assesses emotional and behavioral difficulties in children and adolescents. It evaluates 5 domains: emotional symptoms, conduct problems, hyperactivity and inattention, peer relationship problems, and prosocial behavior. The main purpose is to identify individuals at risk of mental health disorders such as anxiety, depression, attention deficit hyperactivity disorder, and conduct disorder. The questionnaire supports early detection and intervention by providing reliable screening data. It is used by healthcare professionals to facilitate clinical assessment and guide treatment planning. The Strengths and Difficulties Questionnaire is indicated primarily for children and adolescents aged 4 to 17 years. It is designed to assess emotional symptoms, conduct problems, hyperactivity, peer relationship issues, and prosocial behavior. The instrument is most useful in outpatient clinical settings, including primary care, child and adolescent mental health services, and educational environments. It aids in the identification of mental health difficulties, monitoring treatment progress, and facilitating early intervention strategies. Its brevity and ease of administration support routine screening in populations at risk for behavioral and emotional disorders. The Strengths and Difficulties Questionnaire consists of 25 items divided into 5 subscales: emotional symptoms, conduct problems, hyperactivity inattention, peer relationship problems, and prosocial behavior. Each item is a statement describing a specific behavior or feeling. Respondents choose one of 3 response options: not true, somewhat true, or certainly true. The questionnaire can be completed by parents, teachers, or children aged 11 to 17. After completion, each subscale score is calculated by summing the responses to its 5 items, scored 0 for not true, 1 for somewhat true, and 2 for certainly true, with reverse scoring applied to prosocial behavior items where appropriate. Total difficulty score is derived by summing the scores from the 4 problem subscales, excluding the prosocial scale, resulting in a range from 0 to 40. Scores are then interpreted according to established reference ranges. For the total difficulty score, a score between 0 and 13 is considered normal, 14 to 16 is borderline, and 17 to 40 indicates abnormal levels of difficulties. Subscale scores have specific cutoffs. For example, a score above 5 on emotional symptoms suggests elevated emotional difficulties. Interpretation requires consideration of the informant and context, as averages and thresholds can vary by age and population. Clinicians should use these results alongside clinical judgment and additional assessment tools. The Strengths and Difficulties Questionnaire demonstrates variable sensitivity and specificity depending on the population and informant type. Sensitivity refers to the tool's ability to correctly identify individuals with a disorder, while specificity indicates the accuracy in identifying those without the disorder. For instance, in detecting emotional and behavioral difficulties in children, sensitivity values have ranged from 0.7 to 0.85. indicating that the questionnaire correctly identifies 70 to 85% of true cases. Specificity values often range from 0.7 to 0.9, reflecting its precision in excluding unaffected individuals. In a clinical context, a sensitivity of 0.8 means that out of 100 children who have difficulties, 80 would be correctly flagged by the questionnaire. Conversely, a specificity of 0.85 implies that out of 100 children without difficulties, 85 would be accurately classified as not having disorders. These metrics highlight the SDQ's utility as an effective screening instrument, though it should be supplemented with comprehensive clinical evaluation. The Strengths and Difficulties Questionnaire was developed in the mid-1990s by Robert Goodman as a brief behavioral screening tool for children and adolescents aged 3 to 16 years. Since its inception, the instrument has undergone extensive validation across diverse populations and cultural contexts. Psychometric studies have consistently demonstrated satisfactory internal consistency, with Cronbach's alpha values typically above 0.7 for the total difficulty score. Test-retest reliability has also been reported as robust, with correlation coefficients exceeding 0.8 over intervals ranging from 1 week to several months. Validity assessments have included comparisons with established diagnostic interviews and rating scales, revealing moderate to strong correlations that support convergent validity. Factor analyses generally confirm the 5 subscale structure of emotional symptoms, conduct problems, hyperactivity, inattention, peer relationship problems, and prosocial behavior, aligning with theoretical expectations. Furthermore, normative data have been collected internationally, enabling appropriate clinical interpretation across various demographic groups. Large-scale epidemiological studies have employed the Strengths and Difficulties Questionnaire as a reliable screening instrument to identify mental health difficulties in community samples, reinforcing its utility in both research and clinical settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.